Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Drea Brit. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you, everything from nutrition and mental health to alternative therapies and natural living.
We'll bring you the expert interviews, insightful discussions, and practical tips to make motherhood a little easier and help your family thrive.
Please keep in mind that this podcast is for informational and educational purposes only and is not intended to replace the advice, diagnosis, or treatment plans you have with your personal healthcare team. Please have a conversation with your trusted healthcare provider prior to making any changes or implementing any strategies or advice you learn from this podcast.
Whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Here at the Motherhood Alliance podcast, we challenge the status quo, ask the tough questions, and offer a supportive community for moms who want to make an informed, holistic choice.
Thank you for joining us on this journey.
Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with two of the amazing ladies from Alba Birth Center. Katie is a licensed professional midwife who joined Alba in 2016 and has attended over 350 births. She is a skilled educator who brings a wealth of wisdom and is incredible at breaking down complicated topics so her clients can feel supported and informed, and you'll hear that in these episodes. She is a strong advocate for environments that support physiological birth, and Katie loves coffee and has 2 young kids who were born in an out-of-hospital setting under midwifery care. Aubrey is the CEO of Alba, and she oversees the day-to-day operations and communications. She is a huge advocate for birth choice and is passionate about providing top-notch care for families in Northeast Wisconsin. And Audrey also brings a unique perspective to our conversations, as she personally has experienced the difference in birth settings as a mom who has given birth in both a hospital setting and at Alba Birth Center. This 4-part series with Katie and Aubrey includes some really fun topics, including the history of midwifery and current birth choices, the ancestral wisdom of birth, super cool, the cascade of interventions, what it is and how to advocate for yourself, and tips for partners during birth. Be sure to listen to all of them. All right, it's time to dive into today's episode's conversation. We are excited to have Katie and Aubrey here on the podcast with us today. We love to start out by asking our guests a couple of fun facts about themselves. And Katie, you said you're really good at parallel parking. Can you tell us why that one came to mind? And do you have like a story behind that?
I do not have a story for that. I don't know why. My brain just understands parallel parking. So it's a fun fact. And if you ever see me in the community, do not ask me to do it because I will mess it up. So,
well, you just said that you're also really good at, backing up boats in the water too.
I'm not even going to put my name on that one.
I will ask you to do that
because
I need help with that.
No, I will not do that. I don't know why parallel parking in my brain just works. I can do it. I don't know why. And I have no idea when I learned this skill. I was probably in college having my car at school and I have no idea, but there's fun facts.
Hey, it's a good skill to have.
Sure.
Yeah. And Aubrey, welcome.
Thank you. Thanks for having me.
Your fun fact is that you have a large age gap in your kids. How do you handle that? And how old are your kids? And then how is that exciting and how is that a challenge for you?
Yeah, I have a 21-year-old. He's going to be 22 this year. And then I have a 3-year-old and a 1-year-old. So 2 kids back to back at the end. We were trying for a long time and then decided to stop trying. And about 4 months later, we got pregnant with Ty. And then I started with Alba and then had a little surprise again with Tate while I was working at Alba. And yeah, it's definitely different. Things seem different this time around.
I feel like I hear that a lot when people they stop trying and then all of a sudden it just happens.
Yeah.
Yeah.
Yeah. We were really young. And so I'm learning to enjoy it a lot more. Whereas, when you're in your early 20s, just really trying to get by financially and figure out your life, I don't think I enjoyed the little moments. Whereas now that I'm older and more secure, I feel like I can enjoy every day and take it in a little bit more instead of just being in total survival mode when you're younger.
Oh, that makes sense. Yeah.
Ty and Tate are the cutest people alive. So,
aw,
that's amazing.
That helps.
Well, we're excited to dive into talking about midwifery care today. So I think the first obvious question would be, what is a midwife and what does she do?
Yeah. So what a midwife is, to the core of even the definition of midwife is with her. That is the definition. So it is a woman usually who immerses herself into life with other women. And so usually midwives are known for their birth work. Typically we hear of midwives in an out of hospital birth setting, attending home births or birth center births. But a midwife is just a woman who loves women and wants to see them thrive and have birth choices and life choices and really dive into that lifestyle and feel empowered to do those things. And so midwifery care would be, right, if we're talking birth, a pregnancy and delivery and postpartum guided through by another midwife, another woman, just kind of being a guide and a hand to hold and a support person through that.
Awesome. Now, we understand you were an RN before you became a midwife. So tell us about your experience as an RN and what made you make the transition.
Yes. Okay. So I went through nursing school. I went through 4 years of nursing school. I came out with my bachelor's in nursing. I have wanted to be a nurse since I can remember. And I was actually a CNA prior to becoming a nurse. That was what I did all through high school. And then through college, I worked as a CNA. And what I found was I loved bedside care. That was like my favorite thing. I loved to connect with the clients. Well, I say clients, patients, right? So whoever, the people I was working with. And I loved that part of being a CNA. I was at a nursing home, so it was really cute, all the old people. And then I realized I wanted to go to nursing school. I got into nursing school. I went and did that for 4 years. And I had full intentions of being a nurse. I do not have a story of becoming a midwife that was like, I was born and woke up one day and I knew I needed to be a midwife. That was not my story. I for sure thought I needed to be a nurse. That was absolutely the path I was going. And as I was going through nursing school, it was great because I feel like being a nurse is kind of a prestigious thing. I don't know. People are like, oh, you're a nurse. That's really great accomplishment. And we're proud of you and all of that. And then when I got into the field, and even like in my last couple of years of nursing school, I realized that bedside care wasn't bedside care. Bedside care was you can be nice to the people that your patients in front of you, but there's really not a lot of advocacy. You can't really advocate for best care because you're really looking at your own computer and you're being told what you have to do from the orders that are in front of you. So I just realized quickly that like, I think this is not what I thought it was going to be. But I really just was like staying the path. I wanted to be a nurse. And then I had a friend of a friend, basically, who knew Heather, one of our other midwives at the birth center. And there was an opening for a student midwifery position at the birth center. And so she told her and she told me. And she's like, maybe you should go and interview for this. Like, this seems like something you would be really good at. And I was like, I don't actually even know what midwifery care is. That was not where I was. I was in a NICU. Like that was just not at all what my brain was thinking about. And so I went and interviewed and somehow I got the position as a student. And it ended up being just a really good fit with the director and the owner of the practice at that time. And I dove right in and it took me like 1.5 days to realize that was actually what I wanted to be doing. Because that was actual bedside care. That was primary care. It was bedside. It was exactly what I was looking for, but I thought I was going to find it in nursing. And I'm sure you can in certain fields of nursing, you can find that, but it just wasn't happening for me. So I dove right in and then, I don't know, it kind of took over my life and I had 2 kids under midwifery care and I was a student when I was doing that. They were both born out of hospital and it was everything that I wanted it to be, but I had no idea that I wanted it. So it was an answered prayer, but I wasn't aware that I was praying for it. So
yeah. How long is a midwifery training? How long is that?
Yes, that's a really good question. So it's a little bit gray in the state of Wisconsin because there's a few different routes you can take. So because I'm a nurse and I'm a midwife, I'm not a nurse midwife. I did not do my master's degree to get the master's in midwifery degree. I didn't do that route. So I'm a nurse and I'm a midwife. I'm not a nurse midwife. In the state of Wisconsin, there's 3 different ways you can become a midwife. We don't really need to get into the weeds on that unless you're going to do it because it's really confusing. But the approach that I took was more of an apprenticeship style. So I studied underneath a midwife. I had to get X amount of this and that and, birth under my belt, if you will. Tons of observational hours, tons of clinical hours, tons of birth, all of that sort of stuff. And then from there, we sit our boards exam. So we still sit the same boards exam as someone who would go to college.
Okay.
Mm-hmm.
Okay.
So Aubrey, I have a question for you. How do prenatal appointments differ between a hospital provider and a non-hospital midwife? So what if a woman just found out she's pregnant and she's trying to explore different options and she learns about Alba, midwifery, how do the appointments and the layout of her pregnancy go comparing them?
Sure. Specifically, if you find out first that pregnant and you want to come to Alba, we do a consultation first. So it's a full hour. But specifically to the prenatal appointments, they range from 30 to 45 minutes, sometimes an hour or more, depending on where you're at in your care and kind of what you're going through. But the layout is similar to the hospital, where you see your provider at 8 weeks, 12 weeks. So, every 4 weeks, and then it goes down to every 2 weeks, and then every week when you're like 36 weeks and on. So the appointments are much longer. You are going to see your midwife the whole time. You don't see, a nurse to do your vitals and then see the doctor. You're with the midwife the whole time. It's very educational based, focused on kind of what you're experiencing. It's very tailored to the mom and the significant other, the support person. It's a family-based appointment versus an individual-based appointment. It's much more in-depth and, like I said, tailored to that person.
Well, I know that you had a hospital birth and you had the birth at Alba as well. So you definitely have some perspective on that.
I did, yes. My first, so my oldest that I talked about earlier, I am not his biological mom. So I became his mom figure when he was 6. So these 2 younger ones are really my first experience at that delivery, post or prenatal part. But my first was in the hospital. It was before I knew what Alba was. And so the experience was very different. The appointments are a little bit shorter. You spend most of the time with the nurse. Like I said, they kind of do your vitals, and you meet with the doctor and they ask if you have any questions, and then you kind of go about your way, right? Like, I don't think they're even longer than 20 minutes.
Right.
So,
well, you think of all your questions after.
Right. Right. And they kind of limit the type of, the amount of questions that you can do in the time that you take, just due to probably volume of the hospital and policies that they have. So I really loved my OB. We were with her for a really long time, even through the fertility stuff. She's amazing. But even with being with her for 10 plus years, she wasn't the one that delivered Tyson, because it was the on-call doctor that did. So that was a bummer. So that was very different from the prenatal appointments and the experience. And then I did have Tate with Alba.
So did you actually have Tate in Alba then? Or,
I did.
Okay, because I know you guys offer home births too, right?
We do. Yeah. I was not, we were preparing for a potential home birth just because I did go so quickly with Ty. So that was kind of a thought on our mind that it could happen. But no, I did make it to the birth center, and we had him in the azalea room with
Fast and Furious.
It was
that
very
boy
fast.
needed to be here.
He was ready. He was ready.
He was ready.
Now,
Poured on
when
the bathroom floor.
Yep.
Oh my.
Oh yeah.
Yeah.
So there's more of a story behind
There's
that.
a big story. Yeah.
We'll have to do another interview for that one. That's so fun.
So I know with home births, since we're on that topic, that can be kind of scary for some people. Do you typically find it's the pregnant woman that is more nervous about that option, or is it the partner? And then how do you calm their nerves about home birth?
Yes. So this is actually really funny. I am a very straightforward person. If you know me, I just kind of tell you how it is. When a client comes in, or when a family comes in, if it's their first or their second or their third, or if they've had prior hospital birth before and they're like looking for an out of hospital experience, we hear a lot in consults. A home birth sounds really nice, but I don't think that's for me. All right. Maybe we'll do a birth center first and then a home birth. And I always tell people right away, because I don't want anyone to think that there is something magical about a birth center that happens there that doesn't happen at home. What we do at the birth center is the same thing we do at home. And so a home birth and a birth center birth essentially are the same. It's just you're coming to our home rather than us coming to yours. And so I guess the convenience of that would be that you don't have to disrupt your flow of your life. You get to come to us, the mess, right? Even though we clean up your mess, we make your house look prettier than it was before we got there. If you have a home birth, that's something that all midwives just kind of smile about.
Sign me
we'll
up.
do your laundry and your dishes, and you won't even know. You'll like come out of birth land, right? Wherever that is.
Yeah,
and you'll be
wherever
like,
that
oh my
is,
gosh, who
right?
did the dishes? And then it was probably us. So So I always like to be honest with people about that, because there is a thought when people come to the birth center, like, I don't know, it's a stepping stone. It really doesn't need to be a stepping stone. If you are feeling called to a home birth, do it. You'll not regret it at all. And if you're being called to a birth center birth, perfectly fine too. It makes no difference to the midwives, although we do love home birth. We do love the home birth. It's just special to see you guys in your own space, and that's sacred, for you. And so we get to come in there, and there's a different energy about home birth than there is birth center birth for you guys, for the mothers. But in terms of fear around home birth, I think a few things go into play here. First being location, right? So where are you? Are you out in the middle of nowhere? A lot of times that plays a big role, right? Are you 2 hours away from the nearest hospital? That can cause some fear for sure. Versus coming to the birth center, you might have a 2-hour drive to us, but it's only a 7-minute drive to the hospital. And when you think about an out-of-hospital birth, most of the time, the partners, the support people, the dads, the husbands, feel most fear around protective nature, right? They are the ones that are the protectors. They step into that role very strongly in an out-of-hospital birth, as they should. They're supposed to be. And they do that protective thing where they're like, well, what about this and this and this? And what if this happens and this happens and this happens? And I think it's important to be honest with them about, here is what happens when X, Y, and Z happens. There should be no provider out there that's gatekeeping that information, because otherwise there's just fear walking into the birth space, and that's not good for anyone. So talking through, what does a transfer look like? Talking through, how does that work? Does a midwife go with you? All of those things can be really helpful. I think a lot of times people come to the birth center because a mother has an instinct that where they had their baby last, or if it's their first, where they want to have this first baby, is in them. And I know we probably will talk about this a little bit later, but in a different episode, but there is something in a woman that feels like they need to protect their baby. And in our society, we are telling them, no, we know how you should birth, and you should birth it our way, right? And so then when we have parents in front of us, the fear or the hesitancy is usually coming from the partner, because usually dads aren't afraid to say it. And so I think every woman goes through the potential outcomes in their head. No, it's not always talked about, because that's not what we are looking for. And we know that we should trust our bodies and all of that. So yes, usually it's from the dads or the partners. And to that, I just say honesty is the key. Like you have to really look into home birth versus birth center birth versus hospital birth. And I think it's important to define what kind of birth you want before finding the provider. Because if you go to a provider and you say, I want this, this, and this, and they're like, yeah, you got like a 10% chance of getting that thing here. Well, don't hire them, right? Find someone else, or you're going to be surprised at how disappointed you are. But it really wasn't a surprise from the jump, right?
Yeah,
they told you that from the jump. So I think defining what kind of birth you want first, and then finding your provider, is really helpful.
Asking all the questions too.
Oh, all of them.
All of them. Like you just gave a whole bunch of really good ones,
Yeah. I mean, there should be you should come in with a list of, this is an interview essentially, right? It's an interview to see, how is this fit going to go? Are we going to be a good fit with each other? Are you going to help me get the birth I want? Versus, here are the policies we have in place and you must adhere to them. Good luck, right? That is definitely a big hurdle for people. I hear a lot of first-time moms come in and say, we'll go through the consult. I'll give them the spiel. Aubrey will give them her spiel. Diane will give her spiel. And they'll look at us and we say to them, any questions? Do you have anything that you want us to dive into more? And she'll say like, oh my gosh, I don't even know what questions I'm supposed to be asking. Right. And that is a super big thing. If your provider isn't leading the way on, well, let me tell you the questions you should be asking. Right. What's your definition of delayed cord clamping? What's your definition of golden hour? What's your definition of in-room care? What's your definition of post dates, right? Am I going to have an induction if I go past 40 weeks? Or all of these questions, the provider should be guiding, especially first-time parents, through those. It should not be up to them. I should take that back. There is a level of responsibility coming in from the parents. Yeah. And then there's a level of responsibility around, for most people, most couples in America, when they get pregnant, it is the first time that they tap into healthcare. And I'm putting air quotes around that. Right. Because unless you've broken your arm, well, that's easy. You go in, you get it fixed, you get a cast, and you move on. Pregnancy care is a whole different realm, and we just smack it in the middle of like sick care, right? We put it in between the two floors, ICU, maternity care, and med surg. And then we just expect that to be something holistic and something different in the middle of sick care. So it's important for first-time parents to come in with a level of understanding of, what is the birth I want to have? What am I looking for? You're here for a reason. Why are you here? And then beyond that, the providers really should be helping guide those conversations.
Yeah.
So
Do you ladies feel like, where's the trend going? Like, is there more of a demand now for midwifery care? Are there enough midwives to support that?
No.
Where's the trend going?
The trend, actually, you know what? COVID had a weird thing. COVID was a catapult for out of hospital birth, because people really were, their eyes were open to the strict policy that was enforced during that time. Now, those policies don't really happen anymore, right? Like the mask, and your partners might not be able to come in and all of those sorts of things. But what people realized was, oh my gosh, this actually, maternity care has a lot of policy around it. And if there's policy around it, does that mean that I can't voice my opinion and I can't advocate for myself? So before COVID, it was really interesting. It was kind of like, you heard of the people that birthed out of hospital, and they were like, those people, right? They're like, oh, that woman had a home birth. She's wow.
Yeah, weirdo.
Yeah, whoa.
Yeah.
Yes. Now it's much more mainstream. The patient population that we see now, I'm always just like, what? This isn't so many young moms. Like, we have 21-year-olds, 22-year-olds coming through. 23-year-olds.
Impressive.
It's impressive. Like, more mainstream people, right? Like, I know in our world, we're very into like the crunchiness of everything. We have a lot of crunchy moms, if you will. And now there's like not so crunchy moms coming through having out of hospital birth. And the reasons are all very different. They're vastly different. And it's very interesting to watch. So, the trend is more that it's not so much that maybe people want out of hospital birth. It's more of that they're being, alerted to the different parameters that are in place in certain settings. So it's interesting. Mm-hmm. It is really interesting. There are more people around now having out of hospital birth, and you're like, okay, you're not that weird. Like, I thought you were going to be a weird one, and you're not. So it's really interesting. It's been cool to kind of watch that. So I've been part of Alba since 2016. So even in just that amount of time, it's vastly different. It's very cool.
I love the perspective that you shared. I feel like so many families, especially with their first pregnancy, they're just, they just find the phone number of the hospital and this is just what I do.
Yeah.
But that perspective that you gave of almost interviewing your provider first. Well, first of all, setting up what do you want, right? And then interviewing your providers and choosing based off of that. Yeah. And now that we know that there's so many different options, like people have choices, which is just incredible and empowering, especially like you said, this isn't a sick journey. This is a beautiful, empowering journey that women can have choices in.
Yeah. Yeah. I just remember you're talking and I'm like going back to when I first got pregnant, I was like thinking of that too. Like, oh, I just got to call the hospital now. And I called them and they're like, yeah, just come in at whatever weeks. And I'm like, that's it? Yeah. Okay. I didn't know what to ask. All your questions. I'm like, people don't even know what like the golden hour is. And like, they have no idea. Yeah. So yeah, I love what you just said there with empowering them with the questions and leading them, helping them.
I think just knowing that you don't have to do what our society is really pushing. You do not have to do it. There are no rules and laws around birth. Yeah. You can have whatever birth you want to have. The hard part are the hurdles. You have to get to the people that are going to support that kind of birth. And so if it is, if there are a million hurdles in front of you and you decide to go on that journey, it will be worth it. You will enjoy your birth. Every single one of our mom. I mean, I can't even remember the last time we had a mom come through that was like, that sucked. I actually hated this whole journey.
Oh my gosh.
Even people who are like, labor is labor. So there's that.
Right.
No one actually particularly loves the intensity of labor. But the feeling of bringing your baby in the way that you want to bring your baby, most first-time moms don't even know that exists until you have a baby and you realize either that didn't go how I wanted it to go, even though you didn't have prior expectations. The feeling, we get a lot of families coming through who are like, I didn't really know what I wanted or what I needed from birth, but I came away from that experience feeling disappointed. I don't know what I'm disappointed in, but I'm disappointed.
Absolutely.
And then they search for, which is why they're searching other options. They're longing for what is in their DNA of how to birth their babies. So it's very cool. It's a really cool experience. I think biggest takeaway, define the type of birth that you want to have, and then go find the provider that will give that to you.
Yeah.
If you don't want surgery, don't hire a surgeon. If you don't want an out of hospital birth, don't hire a midwife, right? So find the people, find your village, find your people who are going to be like, yeah, this is good. You can do this. Not people who are going to be like, oh my gosh, this is really you're not going to enjoy this at all.
Yeah.
You're going to hate this decision. So,
Yeah. No, I think that's perfect advice.
Yeah. And you know what? This makes me really excited because we're going to be talking a lot about like the ancestral wisdom
Yeah.
and probably some history in the upcoming episodes. So this is like, we're diving right into that.
Yeah.
Yeah.
So if a family is listening to you and they want to learn more about Alba,
Yeah.
how should they connect with you?
yes. So we offer free consultations at the birth center, which is basically like an hour tour. So you get a half hour with a midwife. Every person gets to sit down with a midwife. That's important. And then there's a half hour with just like administrative stuff. So talking about finances, talking about, contracts, the boring stuff, if you will. So they can call and they can set that up. The girls up front are wonderful and they will not be like, yep, this is it. You just come in.
They are, we've met them.
chipper.
They are awesome.
Yeah, they're energetic. And so, yeah, you just call them and set that up and you get on our schedule. We're really not, we try and get people in within the first couple weeks of their call. And it's great. We love sitting down with clients and getting to know them and how we can help them. We go through health history too. So that's also a point I will say. Midwives are out of hospital providers who can do low risk moms and babies. And so if there is a high risk finding, of course, that may not be always the safest option to have your baby out of hospital. And so we do have some limitations, but it's pretty gray in Wisconsin. We have some pretty good legislation that allows us to have autonomy around who we care for, what that looks like, regulations here and there. So it's pretty good in Wisconsin.
That's
Awesome.
great.
Well, thanks for sharing that. And thank you so much for joining us. And we can't wait to do more episodes with you.
Thanks.
If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.